Bonnie Marting, A.P.R.N. at Anushka Cosmetical Center here in West Palm Beach. And this is my patient, Kathy. Hi, Kathy.
Hi, Dr. Bonnie.
Kathy and I have been talking about how to just keep somebody a little more refreshed, pick up a few things that have started to fall over the time. And so what we're discussing, what would be a good opportunity for her, would be some threads in a thread lift to just kind of pick up some of the little things that are starting to fall, like this starts to fall a little bit. So what threads are, Kathy, is they are PDO, it's polydioxanone. Polydioxanone has been used for decades in medicine. If you were to have an open heart surgery or maybe an appendectomy or something, inside they sew you up with this type of material. So material's been out for a long time. What happens with that material is you end up absorbing that into your system, but your body finds it and it wants to put collagen around it. So that new collagen, type 1 collagen, is very tightly wound, so it gives you this nice tight appearance after you absorb those threads. So the threads that we put in your face are actually absorbed in 4 months, replaced with your beautiful collagen, and that just keeps you up there and looking great for about 12 to 18 months, and then you just kind of tweak it after that. If we want to, at that time we might put in more volume with something, or we might just pick up a little bit more with threads. Okay?
Sounds amazing.
So let's talk about what we would do, because you look great, you really do, but everything starts to fall. This starts to fall forward. So what we're going to do is we're just going to kind of pick this up a little bit. And what we do is we insert this little thread from up here in a tiny hole made by a needle, and then we would insert it down to this particular point here, and that's going to give you a nice little lift there. Now because we have a little bit of a bulk here, we want to do kind of the same thing. We're going to pull one back this way also. But if we take the same little area here and just put one to match up here, then we're going to get a little bit more pull like that. If I can pull you fairly easily, the threads can pick you up pretty nicely too. Then we always have a little bit of a joweling issue that's starting. You're still pretty young, but it's starting a little bit there. So what we like to do is just kind of pull that back using a larger thread to kind of pull that back and then create some nice pull back there. And then everybody starts to get this little thing. Everybody hates this little thing. What do you think of that little thing?
It's annoying.
Annoying, I know. And we always see it, and we see it more than anybody else, so nobody else really cares, but people get annoyed with that. So one way to actually pick that up is turn that way. Is you have a muscle right here. If we insert a little thread right here, we can go all the way across here with that little thread, and then we'll do the same on the other side. And then I'm just going to have you put your head back a little bit. So then what we also like to do is put in a little bit of these threads in here that's going to grow your own collagen in a very nice way, and it's going to continue to pick you up. And we'll also put a couple of those little threads this way to help keep that collagen very healthy in your neck. And what that does then is it pulls up this way, pulls that way, makes new collagen everywhere. Now additionally, because we have some issues sometimes up in the forehead, we can actually pick this up a little bit. Everybody likes their eyes picked up a little bit. I know that, you know, we've done some neuromodulators in the past, and you like that look when things are smooth and lifted up. So what we can do is we can take just a little bit of a thread out here. This is a little bit of a shorter one. This one actually will pick up. That's not just a collagen thread. And it will actually pick up that lateral brow a little bit to give you a little bit more open appearance, even though you look really good. You really do. It's just going to keep you fresher. You know, you understand that. And then in here, we all start to lose some volume because we have this fine layer of fat underneath our skin. As we're moving along, it starts to decrease. And so we end up getting little hollows in here. I hear that from so many people. You've got that hollow up here. Well, it's no longer really safe. It never has been, but it's not safe to really fill that with fillers. So what we like to do is just put some collagen threads in here. You can either do it like this, and that's just going to replace some collagen and just get your own stuff growing a little bit more. And that way you're going to be safe. It's going to grow some collagen. It's going to give you a little bit more depth up there as far as not so much right on bone, and it's just going to keep you looking fresh and nice. And then we might end up putting one more thread just right about here, because we can pick this up a little bit. After we do that and it starts to absorb and pull up a little bit, we'd probably end up putting a little volume in here with some either Restylane Lift or some Voluma, just to keep you nice and positive looking, because when you have a nice little projection like that, it's positive looking. But with this, we're actually going to be able to probably put you back about 10 years or so, and keep you nicely refreshed.
Perfect.
Do you have any questions about what we've talked about?
No, No, because we've talked about it before, and I think I'm ready now.
Okay. Okay. Well, all right then. We'll get started.